So, very good evening, everyone. It again gives me immense pleasure to welcome you all for this another, I would say, a interesting episode on most needed topic of the hour, obesity. I think one thing which has done to all of us in this pandemic is obesity. I am sure all of us have gained a lot of knowledge, and all of have us gained a lot of some here, somewhere, some weight here and there. Obesity is now a global concern. You will be surprised that according to the latest guidelines of ICMR, it says that India has a prevalence of around 17 to 30% of obesity, and this does not just qualify, or this does not stick to the elderly or the middle-aged people. You'll be amazed even that the rate of children obesity is also growing at a very faster pace. Obesity is now linked to almost more than 60 chronic diseases. And I think your waist size decides your risk of developing the other non communicable diseases like hypertension, diabetes, and the list goes on. So to talk on that, we have a very interesting and elite panel from across the India today. May I first welcome Dr. Neeta Deshpande, ma'am. She is the professor and HOD at Dental College, consultant physician and bariatric physician from Belgaum. Very good evening, ma'am.
Good evening.
Uh, I will welcome next Dr. Arundhati Dasgupta, consultant endocrinologist, director at Rudraksh Super Specialty Care, Siliguri, West Bengal. Very good evening.
Good evening.
And then it again gives me a lot of pleasure to welcome Dr. Nitin Kapoor. He is the professor of endocrinology at one of the prestigious institutes, CMC, Vellore, what we have in India. Very good evening.
Hello.
Yeah. So without taking much of time, I would hand over it to Dr. Neeta Deshpande to take it ahead. Over to you, ma'am.
Thank you so much, Faraz, and I'm thankful to RSSDI for giving us this opportunity to talk about a very interesting and burning issue that we have today, and that is obesity. We all know that obesity is the mother of all diseases, so we're going to, have a little chat with each other about some of the patients who come to us, ask us different things, and whether they are myths or realities is what we are going to see. And the first thing that I'm going to talk about, one of the myths, is patients coming to me and telling me, डॉक्टर साहब मैं बहुत tall हूँ, I'm quite tall, और मेरा वेट दिखता भी नहीं है, तो should I be considered obese? So the question is, it's not important what your mirror tells you. It's important what your weighing machine is telling you. So that is important. आपका वजन कितना है और वो भी आपके height से हिसाब से आपका वजन कितना है. And that is what we call body mass index. It's a ratio. हाइट और वेट का जो रेशियो होता है उसे बॉडी मास इंडेक्स कहते हैं. और फॉर इंडियंस द नॉर्मल बॉडी मास इंडेक्स इज बिटवीन 18 to 23. सो अगर आप टॉल भी हो और अगर आपका वेट BMI reflects that it is 24 or 25, it means you are overweight or obese, which means that you are at risk for disease. So दिखने से कुछ नहीं होता है, आपका BMI क्या है ये important है. But by the same token, ऐसे भी patients आते हैं, अरुंधति, I would want your opinion on this, जो बोलते हैं कि मेरा weight मेरे height के हिसाब से ठीक है, थोड़ा पेट ज़्यादा है, my belly is a little bloated, but otherwise I'm fine. So क्या इन्हें भी हम obese कह सकते हैं? Can we call them overweight? Because their overall BMI is fine, लेकिन उनका पेट का waist का size थोड़ा ज़्यादा है. What do you think?
Thank you, ma'am, for that very interesting question. And as you very correctly said, जो दिखता है सिर्फ वो इम्पोर्टेंट नहीं है. आई वुड गो स्टेप अहेड एंड से जो वेट करता है सिर्फ वो इम्पोर्टेंट नहीं है, बाकी आप also have to go by certain other things, because today we appreciate what we know as normal weight obesity. Generally जो हमारा जो इंडियन स्ट्रक्चर जो होता है, we tend to accumulate the weight around our bellies, and so because we grew up seeing this belly around the abdomen, we tend to take it as okay, this is quite natural, but उतना भी नहीं है, but थोड़ा सा है. But unfortunately, that thoda sa fat is in an area where it has a worse prognosis, because यहाँ का जो fat होता है ये सबसे खराब fat होता है. And we know about concepts known as like visceral obesity, which means like fat accumulation around the different organs like the liver or in the heart. And we know today that even though apparently the person looks okay and his weight is also within the BMI frame, but because of this accumulation of fat in the wrong areas, particularly around the abdomen, that has implications in long-term consequences. And we also have a lot of research on that issue now, some of it which has been done by Dr. Nitin Kapoor himself. Like, so we have seen data that long-term consequences of these people who are so-called normal weight over a period of time when they are followed up. It's seen that the side effects of obesity, as we can call them, say whatever cardiovascular ho या और कुछ हो, hypertension, blood pressure, कोलेस्ट्रॉल लेवल्स हाई होना, ये सारे वाले प्रॉब्लम्स जो है इन लोगों में ज़्यादा होता है. सो weight is important, BMI is important, but we also take into account abdominal circumference, which is also important. So
Right.
I will go ahead one step ahead. Dr. Nitin, generally when we talk about say किसी को pressure, high pressure है, sugar है, तो they are concerned, they are worried. But generally when you're talking to people about obesity, it will be something that is associated with humor, right? थोड़ा सा मोटा, and then they smile. Nobody is going to come and smile and tell you that मुझे diabetes है. But so, do you think that we should be putting across diabetes as a disease? I mean, sorry, obesity as a disease, or is it just something to be taken not so seriously as the other ones that we generally talk about?
Very rightly said, Dr. Arundhati. And the common concept in North India is कि थोड़ा सा मोटा है तो खाते पीते घर का है, पतले लोग तो पता नहीं कहाँ से आए. तो I mean that is I think a biggest myth and something that needs to change overall. I think globally देखा जाए तो International Obesity Society, the American Obesity Society, way back in 2008, they said that obesity should be a disease. The AMA accepted it almost 10 years ago. But in very simple words, as you rightly said, when we treat a patient with diabetes, जब diabetes है तो patient आता है डॉक्टर के पास, ट्रीटमेंट लेता है और बोलता है कि ठीक है डॉक्टर ये ट्रीटमेंट दिया, पर 3 महीने के बाद दोबारा जाता है. ये नहीं कि एक बार ट्रीटमेंट लिया और लाइफ लॉन्ग की डायबिटीज क्योर हो गई. It is a lifelong process. It needs a good follow-up. It needs modification in treatment and it needs those iterations. तो वही obesity के साथ भी है. आज obesity है, मैंने आज डायटिशियन को देख लिया, डॉक्टर को देख लिया, तो मेरे पूरी जिंदगी का ओबेसिटी का इलाज नहीं हो गया. इट इज अ chronic disease and it has to be treated like that. And today we have very good medicines, very good treatment plans that we can offer to patients, but you need to go to the doctor and understand कि ये disease है. But another very important question जो clinical practice में we really encounter, and maybe if I ask Dr. Neeta about her thoughts, many times patients जिनको थायराइड की प्रॉब्लम होती है या नहीं भी होती है, तो वो सोचते हैं जो वेट की प्रॉब्लम है सारी की सारी इस थायराइड की वजह से है. थायराइड आज हो गया तो अब मैं जिंदगी भर वजन लूज नहीं कर सकता. तो व्हाट आर योर थॉट्स ऑन दिस काइंड ऑफ पेशेंट?
ऐसे बहुत सुनने को मिलता है. दैट इज ह्यूमन नेचर कि आई एम ओबीज और आई हैव डायबिटीज, सो ब्लेम समथिंग एंड ब्लेम समबडी. तो ऐसे बहुत सुनने को मिलता है कि डॉक्टर मैंने बहुत कोशिश की वेट लॉस करने की, लेकिन मेरा वेट घटता नहीं है क्योंकि मुझे थायराइड है. सो देर आर सो मेनी पीपल हु कम एंड टेल अस कि मुझे थायराइड है इसलिए मेरा वेट कम नहीं होता, आप कुछ कीजिए. सो व्हाट आई वुड लाइक टू टेल आवर ऑडियंस इज दैट if you have thyroid disease, particularly what we are talking about here is hypothyroidism. इसका मतलब है कि थायराइड का फंक्शन कम है और आपको उसकी गोली लेनी पड़ती है हर रोज एक. अगर गोली लेके आपका थायराइड फंक्शन नॉर्मल दिखाता है आपके ब्लड टेस्ट में, तो यू आर नॉर्मल लाइक अदर पीपल. It means that that is not interfering with your weight loss, which means you have taken a thyroid tablet, your thyroid levels are now within normal range. So now, whatever obesity you have, it is because of proper obesity and not because of thyroid. So it is very important to understand that only uncontrolled hypothyroidism or untreated hypothyroidism can be a cause for increased weight. ऐसा नहीं होता है कि थायराइड नॉर्मल हो और वेट नॉर्मल और आपका थायराइड लेवल्स नॉर्मल हो और आपका वेट नहीं घटता है. Then you have to be treated for other reasons, such as other reasons for obesity, like your intake and your exercise. So ये बहुत important चीज है. So it's not okay to blame the thyroid. Get your thyroid levels checked, get it under control, and then find out what is the cause of your obesity. So ये obesity जो है, जैसे अभी अभी नितिन ने बताया कि ये chronic disease है. So chronic, when we call it a disease, it means it has consequences, because every disease has consequences. So I would like to actually pass on the baton to Arundhati and ask her कि obesity जो के जो consequences होते हैं, जो result होते हैं, वो किस तरह के होते हैं? Short term भी होते हैं, long term भी होते हैं, और वो क्या होते हैं? What should people know about what obesity can actually lead to?
Right now. So obesity, if we talk about short-term effects or problems with obesity, generally क्या होता है कि a person is overweight, he's a little breathless, he's unable to walk a lot, he's unable to work a lot, he gets fatigued very easily, or maybe when he's sleeping, he's snoring a lot and he's getting up, something which we call sleep apnea. Then he starts having aches and pains, and then the blood pressure starts gradually it's shooting up, it's higher, blood sugar levels are also gradually going higher, cholesterol levels are going higher, and then over a period of time these short term things go up to the long term consequences, wherein the patient develops hypertension, the patient develops dyslipidemia, patient develops diabetes, or develops fatty liver, or has gallbladder problems. And if you look at the musculoskeletal effects, then he develops osteoarthritis. And sleep apnea, as we were just saying, can have a lot of consequence and can be very disabling for a lot of people. Also, obesity has been associated with some cancers, like cancer of the breast, of the uterus, of the gallbladder, the liver, so and the colon. So these are some of the side effects, or you could put in the complications with obesity. These are just to name a few. There are also a lot of other things which are associated with obesity, but generally that is why, because there are so many consequences of obesity, that is why it has been today termed as a disease, as my previous speakers have said. So, Dr. Nitin, have you realized that sometimes when we ask our patients to, follow a diet and exercise, and they come back very happy. Okay, fine, we've lost weight. And then the next time when they're coming back, the weight has come back. Then they tell you that, okay, I've been doing the same things kind of, but why is it that I've not been able to retain it? Or maybe I've been a little lax with my things, but I've not been able to retain the weight that was lost. It has all come back. So, what do you have to say about that?
Absolutely. So very common clinical scenario jab patients lose initially a lot of weight, but then they stop gaining that momentum of losing weight after that. So I think I'd like to highlight again today we understand obesity as a disease not only because it causes so many consequences, but also because we understand the basis of the disease itself. हमें मालूम है कि आज जब हमारा वजन बढ़ता है वो केवल सिर्फ हमारी चॉइस है कि हम ज्यादा खाएंगे और एक्सरसाइज नहीं करेंगे, सिर्फ वो नहीं, पर वो चॉइस क्यों है? हमारे ब्रेन में कुछ हार्मोन्स, कुछ न्यूरोकेमिकल्स, उनके ऑल्टरेशंस वो जब होते हैं जिससे हमको भूख ज्यादा लगती है, हमारा एनर्जी एक्सपेंडिचर कम होता है. When we understand these concepts, we understand that there is a biological rationale behind somebody gaining weight. And once we know that, then we can answer this question कि क्यों शुरू में हमारा वजन थोड़ा तेजी से कम होता है और उसके बाद धीरे धीरे और मुश्किल होता जाता है. एंड इन मेडिकल टर्म्स वी कॉल इट एज द मेटाबॉलिक सेट पॉइंट थ्योरी, जिसमें हम बोलते हैं कि शुरू में जब हम वजन कम करते हैं हमारी बॉडी के जो भी मैकेनिज्म्स हैं वजन बढ़ाने वाले वो बढ़ जाते हैं. जैसे इफ we feel probably more hungry once we've lost some weight, our same amount of exercise does not result in that much amount of energy expenditure. And that's why gradually it tends to become more and more difficult. But even if I say it becomes difficult, it doesn't become impossible. It is possible. And if you have your obesity physician with you and you follow up regularly, today there is a step by step approach where we can add on therapies, be it intensive behavioral therapy, be it medications for weight loss, or even if required, other procedures and devices and surgeries. There's so much. But yes, it does become difficult to lose weight as we go along the journey. It is important to maintain it, but it is possible. And in my practice, I would say कि जो लोग regular follow up पे हैं, उनके साथ ये प्रॉब्लम कम होती है, rather than जो लोग साल में एक बार आते हैं और फिर बोलते हैं कि हम कम किए थे फिर बढ़ गया, and that's not the way. I think the bottom line is we have to consider obesity as a disease. It's no longer a risk factor कि हम बस उसको ले लिए and मतलब it's not खाते पीते घर का. as I mentioned before.
Yeah.
So I think this takes me to another very important question कि हम weight loss की बात कर रहे हैं and बात कर रहे हैं कि कैसे weight loss किया जाए. And patients हमेशा पूछते हैं डॉक्टर क्या diet important है या exercise ज़्यादा important है. And I think Dr. Neeta has been running a very successful obesity clinic for so many years, and I've seen that with my own eyes. I think it will be real pearls of wisdom to hear from her कि क्या important है.
Thank you, Nitin, for that question. And that is easily the top debate of all time amongst patients and among doctors also. So, diet and exercise, दोनों भी important है. They are complementary to each other. Both are important, but there are certain very important nuances to this. जैसे कि अगर ओबेसिटी और वेट लॉस को देखा जाए तो हम बोलेंगे कि ये मैनेजमेंट जो है ये दो स्टेजेस में होता है. पहला स्टेज जो होता है दैट इज द स्टेज ऑफ एक्चुअल वेट लॉस, एंड देन एज नितिन मेंशन्ड अ लिटिल व्हाइल अगो कम्स द वेट मेंटेनेंस पार्ट. सो मैं सिंपल टर्म्स में कहूँगी कि इनिशियल पार्ट में मतलब वेट लॉस के पीरियड में द फर्स्ट स्टेज जो होता है, फर्स्ट स्टेज में diet is slightly more important than exercise, and there is research that shows this, that you have to cut down the calories. You have to also, important is you have to know your carbohydrates, your proteins and fats, and overall diet composition and dietary calories become more important. Diet in general is more important in the first stage of weight loss. बाद में during the weight maintenance period, diet continues to be important, but then exercise becomes almost equally important. And the reason that was given just now to you, as Nitin said, is आप diet करते जाओ, आपका weight घटता है. Up till then it is slightly easy, लेकिन वेट घटने के बाद आपका मेटाबॉलिक रेट जो होता है वो कम होने जाता है. दैट इज योर बॉडी स्लोज डाउन अ लिटिल एंड यू स्टार्ट टू बर्न लेसर कैलोरीज. मेटाबॉलिक रेट जो है वो बढ़ाने के लिए एक्सरसाइज की बहुत मदद होती है, और बहुत रिसर्च में ये देखा गया है कि वेट लॉस के बाद अगर एक्सरसाइज नहीं किया जाए तो देन द वेट कम्स बैक. So for weight maintenance, exercise is very, very important. So as I said earlier, to sum it up, diet and exercise are both very important. But first stage of weight loss, diet is slightly more important. In the second stage, diet is equally important, but exercise gains lot of importance for weight maintenance. I would put it that way. So coming to the diet, as I said, diet is very easy in the sense that different kinds of diets, all of them give weight loss. But what I would like to ask Arundhati is that in your experience, what would be the natural ways to lose weight? What are the natural diets and what are the natural ways to lose weight? Because that's what patients keep asking us. And is it enough always to do only these natural ways?
So yes, there are some natural ways which we put across to our patients. First of all, I think it's about a balance, because we have people coming to us who are like hell bent on losing weight, and they go through fat diets, they follow this diet, they follow the keto diet, intermittent fasting, this, that, a lot of things. But I would say two things. One is balance. Number two is consistency. Whatever you're doing has to be a balanced approach which you can carry ahead. It as ma'am just said, it's not enough to do it for a month. बस एक महीने के लिए कर लिया, 2 महीने के लिए कर लिया, फिर बस हो गया, वो तो नहीं होगा. You have to do something जिस जो आप continue कर सकेंगे, so that you can retain that. Number one. And number two, it should not end up causing problem to some other organ of your body कि weight lose करने के चक्कर में heart में कोई problem हो गया, वैसा भी नहीं होना चाहिए. So what would you do? It's about cutting down on the high calorie food generally. You would want to cut down on say simple sugars, high simple carbohydrates. वो हम नहीं चाहेंगे कि आपके डाइट में बहुत ज़्यादा रहे. We would want you to put in a lot of fibers. And generally when you're talking like that, you would say, we keep on hearing these things कि ये नहीं खाओ, वो नहीं खाओ. It's not that. It's just about आप जो generally खाते हो उसी में से आपको चुनना है कि किसमें high calorie वाले substances कौन से हैं. You're not going to go all out. कोई बर्थडे होगा, कोई एनिवर्सरी होगा, कोई ये होगा, कोई वो होगा. आप बीच बीच में there will be ups and downs in your dietary thing. You have to accept that. And having accepted that, you have to go ahead and plan. So take in a lot of fluids. We talk about a balanced plate wherein half of it consists of proteins and fibers, and then the rest is divided between carbohydrates and fats and vitamins. So that is how you go about it. Get good sleep. drink adequate amount of water, cut down on the alcohol content, because alcohol, remember, is also a high source of calories. And nowadays we have these trackers wherein you can actually track what you're eating, what is the calorie content. You have these apps telling you about how much you walked, and that helps you. You might think that, okay, these are not going to help me much, but they do actually help, because they help you modify your actions accordingly, right? But at times we do see that, in spite of putting in all kind of dietary changes, it's not good enough, and patients come and tell us, so are you going to give me some medicine? Are you going to help me out with some medicine? So Dr. Nitin Kapoor will tell us about what is the role of medications in the treatment of obesity.
Thank you. And as you rightly said, yes, it's important to start with diet and exercise. In clinical practice, that's always the first line of treatment. Uske baad, yes, medications have a role. And as I mentioned before, today we understand obesity with a biological basis. तो जब हमें मालूम है कि कुछ हार्मोन इम्बैलेंस होते हैं जिससे भूख ज्यादा लगती है या हमारा एनर्जी एक्सपेंडिचर कम होता है, तो जब हम उन टाइप के हार्मोन्स के बारे में जानते हैं, तो ऑब्वियसली विद रिसर्च वी हैव ओवर द इयर्स नोन medicines which are safe and effective for weight loss, which are many of them in practice, some of them in the pipeline, some very good medicines also in the pipeline. But yes, so medications have a role. I never start them on day one. आज आए हैं वेट लॉस करना है, आज से दवाई शुरू, वैसा नहीं है. डाइट एक्सरसाइज करेंगे, उससे थोड़ा वजन कम करेंगे, उसके बाद आप आएंगे वापस, पेशेंट वापस आएंगे, बोलेंगे डॉक्टर साहब इतना वजन कम हो गया, अब नहीं हो रहा है. उस टाइम पे आई डू कंसिडर medications, and there are medicines specific for obesity. But the other important point that I'd also like to highlight, it's not only about medications of obesity. हम एक पेशेंट को सिर्फ वेट के नजरिए से नहीं दे सकते. एज अ फिजिशियन हम पेशेंट को एज अ होल देखना है. पेशेंट को वेट की प्रॉब्लम है, साथ में शुगर, बीपी, मेंस्ट्रुअल प्रॉब्लम्स, साइकोलॉजिकल प्रॉब्लम्स, काफी सारी और प्रॉब्लम्स हो सकती है. उनकी दवाइयों से भी वजन बढ़ सकता है. So it's not only important to consider changes of medicines only for weight loss, but also to address the concomitant medications that the patient is taking. जैसे शुगर की कुछ दवाइयां हैं जिससे वजन बढ़ता है, कुछ दवाइयां ऐसी हैं जिससे वजन नॉर्मल रहता है, कुछ दवाइयां ऐसी हैं जिससे वजन कम होता है. तो अगर मेरे पेशेंट का वजन ज्यादा है, let me choose a medicine for diabetes which helps in weight loss, and similarly for hypertension, similarly for menstrual problems, and similarly for depression and other comorbidities which are commonly seen. So yes, medicines definitely have a role. It should be given by a qualified physician. ऐसा नहीं कि किसी फ्रेंड कोई दवाई खा रहा है, आप भी खा लेंगे तो वजन कम हो जाएगा, उससे नहीं होगा. But in a systematic matter, does make a good effort and really helps in weight maintenance. जैसे डॉक्टर नीता पहले बोल रहे थे, वेट लॉस एंड वेट मेंटेनेंस मुश्किल होता है, पर मेडिसिन से उसको इजी किया जा सकता है. So I think that's important. But I was talking about diabetes, and let's take it a little further. And many times, I would say, many of our patients with diabetes also have obesity. So if I ask Dr. Neeta कि क्या जो शुगर वाले पेशेंट्स हैं उनका वेट कम करना मुश्किल होता है, या कैसे people with diabetes should lose weight?
Yeah, thanks for that question, Nitin. And I would actually say that diabetes and obesity, since we are on the issue of pandemics, I would say that diabetes and obesity together are twindemics, if you can say, because they are literally like twins. And obesity causes diabetes, and diabetes makes it worse to reduce weight. See, the first and foremost thing is that a person who has diabetes is already dealing with one chronic disease. Added to that, if he also has obesity, it makes it that much harder. There is the fatigue of chronic disease, a sense of desperation, doesn't want to do it. He already has so many dietary restrictions, ये नहीं खाना है, वो नहीं खाना है, और हम बोलते हैं कि अभी वजन भी कम करो, और भी restrictions आते हैं. So it makes it a little harder. On top of that, जैसे अभी अभी नितिन ने बताया, ऐसी दवाइयाँ हैं, इंसुलिन का भी है, इंसुलिन भी है, और देयर आर सर्टेन टैबलेट्स आल्सो जिससे वजन बढ़ सकता है. और अभी nowadays we have medicines that can actually make you lose weight, not just weight neutral, but they can actually make you lose weight. So आपके डॉक्टर से आप पूछ सकते हैं कि क्या आप हमें ऐसी दवाइयाँ दे सकते हैं जिससे एटलीस्ट हमारा वजन ना बढ़े, which is called weight neutral drugs, या फिर ऐसी दवाइयाँ दे जिससे वेट एक्चुअली कम हो सकता है. वी हैव टू क्लासेस ऑफ ड्रग्स. वन इज SGLT2 इनहिबिटर्स, विच इज यूज्ड फॉर डायबिटीज. उससे थोड़ा सा वजन कम हो सकता है, सो एटलीस्ट यू विल नॉट गेन वेट. बट The real breakthrough is a group of drugs called GLP-1 receptor agonists. Nowadays, it is actually in the form of injections, but luckily we now have one of the GLP-1 receptor agonists which has come in the form of a tablet. So these medicines can actually make you lose a lot of weight. And in fact, ये दवाइयाँ ऐसी हैं कि though they were initially licensed for use as anti-diabetes medication, abhi in some countries they are licensed for use for weight loss even without diabetes. So it is harder to lose weight if you have diabetes, but you can actually circumvent it now with modern medication that you have and a good diet plan. So lifestyle modification is not to be forgotten. दवाइयाँ जरूर हैं, लेकिन no medicine in the world is going to work its charm unless lifestyle modification is also practiced. So yes, it is more difficult for diabetes patients, but it is not impossible. So the next thing that I would like to ask is to Arundhati. See, diabetes is one difficult problem. So the other thing is that in my obesity practice, what I see is that I think it is 80-20. 80% of those people who come are women looking for weight loss, and 20% of them are men. So do you think it is harder for women to lose weight, or are women more prone to obesity at different times of their lifespan, like reproductive age, menopause, or at puberty? So what is it like? Are women really more obese?
I wish I could have said no, ma'am, but the answer, unfortunately, is yes.
Yes.
Across the globe, whether we are talking
Yeah.
about developing countries or we are talking about developed countries, the percentage of women with obesity is more than men with obesity. That is there. And even the body fat percentage in women is more as compared
Yeah.
to men. Though we do have a hormone called estrogen, which has a kind of protective effect because it causes the fat distribution to be pear shaped rather than the apple shaped, which is around the bellies, and pear shaped is around the hips. That's in the premenopausal. But postmenopausal, that protective effect of estrogen also goes away. Apart from that, there have been a lot of studies which have looked into the cause of more incidence of obesity in women, and various factors have come ahead, starting from hormonal factors to stress related factors to nutritional factors to metabolism. The same amount of food taken in by females and males are processed differently because of the difference in the metabolic factors. Then there are stages in a woman's life, like say for example pregnancy. Now generally, now there is this tendency to overfeed women during pregnancy, and the more weight they gain, the better it is, the healthier the child will be, is the general concept that's present across the group. So to change that, because the amount of weight gained, a lot of females would tell us that I have not been able to lose that weight post delivery, because obviously not all of it is related with the delivery, and if you eat that kind of food, that's going to stay there. And that is one phase: pregnancy, lactation. So people who have more number of pregnancy, multiparity is again linked with obesity. These are factors. Also postmenopausal is a phase wherein again the metabolism factor comes in, the protective effect of estrogen goes away. This is also another phase where women generally tend to gain a lot of weight, particularly around the abdomen. And that is why we also see the effects of obesity happening, the cardiovascular aspects, hypertension, diabetes, all of these happening more in these phases as compared to the others. And at times, obesity, it is a disease, but at times it's kind of looked at with from a negative aspect, and people with obesity tend to go into depression. They have, and sometimes though we tend to take it a little lightly, and but at times it can be really difficult, because we've seen depression, suicide, these have been linked more closely to obesity. So Dr. Nitin, would you tell us, when should a person with obesity take maybe a psychiatric consultation, or do we regularly need to be in touch with a psychiatrist when we are dealing with such patients?
So I think that's a very, very important question. And what I would say is that obesity and psychological problems, this is a bi-directional problem. So when we have a patient with obesity, that itself can have so much stigma associated with it, can lead on to depression. And when somebody has depression and taking medications for depression and other psychological disorders, that itself can lead on to obesity. So it's a bi-directional relationship. It's not that only obesity leads to psychiatric problems or psychological problems can lead to obesity. In a study that we had published from our center in a multidisciplinary clinic here at CMC Law, we found that 30%, 1 out of 3 patients who walk into the clinic actually need some psychological help. And that's a large number. But yes, so for a protocol, if possible, I know it's not readily available. Psychiatrists are very few in number, but if possible, yes, I think every patient with severe obesity should at least have one session with a psychiatrist. But if not, definitely all people who are going for bariatric surgery, who are on anti-obesity medications that sometimes can have some side effects, or those requiring intensive behavioral therapy, those who are having sleeping problems, should see a psychiatrist. And it is a very, very important component of treatment of obesity. So I think I'll stop there, and we've just overshot time a little bit, but I think we've really had a very interesting discussion, and really like to thank RSSDI for having me here. And I'd like to hand over to Dr. Faraz for his concluding remarks.
Thank you so much, Dr. Nitin. I think we all loved the interaction which happened, and I think many of the questions which are very, very practical have been answered, because I think जैसे आप लोगों ने बताया है, weight loss करना बहुत शुरुआत में it is very, very easy, and then comes the problem, how to maintain it. And I think वहाँ पर जाकर ही 70 to 80% और लोग जो हैं वो हिम्मत हार जाते हैं. And then you rightly said the social stigma. I think obesity is now a big social stigma. तो आप लोगों ने उसके बारे में भी बहुत अच्छे से discussion किया. I really liked the other two panelists also talking on that it is why it is important, the complications associated with it, how the females are facing the problems. And then yes, it is not only the BMI, it is the central obesity, which is very, very important. And in a country like India, where we all are prone for developing diabetes, we are prone for developing other metabolic complications. So it is very, very important. It is imperative that we take this as a very important problem as we take the other problems as well. So do visit your physician on a regular basis. Stick to your lifestyle routine as you have been advised, and do physical activity. I think वो बहुत important है. And now with the COVID thing going off, things opening up, I would say do make an effort कि आप daily at least 30 minutes of physical activity in any form. Please make it a habit, because this has to be a habit of physical activity, has to be a habit. It has to be in your routine. So in the end, I would like to thank Dr. Neeta Deshpande, madam, for her excellent presentation. Thank you so much. Dr. Arundhati, for sharing your valuable insights. Thank you.
Thank you.
And Dr. Nitin Kapoor, thank you so much for enlightening us with all your clinical and experience background. Thank you. So in the end, I would just say lose weight and gain life. Stay safe. Thank you.